Hello everyone, today we are talking about the risks of intermittent fasting, especially when you are on diabetic medications or have certain medical conditions, and how to prevent or reduce the risks. Hi, you're watching SugarMD Diabetes channel. My name is Dr. Ahmed Ergin. I'm a diabetologist and a hormone specialist. Before we get into it, especially if you have seen some of our other videos and already fell in love with them, smash the subscribe button to avoid missing any content and learn from the expert for free. Let's get started. Intermittent fasting is becoming more and more popular as a way to lose weight and control chronic diseases, right? Patients with diabetes mellitus, both type 1 or type 2 diabetes, make up around 10% of the population in the United States. Well, they are likely to be interested in one of the many methods of intermittent fasting, and there are only a few studies on the safety and benefits of fasting for people with diabetes. And the health advice today comes from mostly weight loss gurus or animal studies, which aren't very good for people with diabetes to get advice from, right? There are no medical guidelines on how to manage therapeutic intermittent fasting in people with diabetes, especially if you are on medications. Now, your clinic doctor will say, don't fast. And there are YouTube doctors who will say, fasting will fix everything. And yet you're scared because you can't decide what to do with your medications while fasting because you're scared your glucose will bottom out on those medications, right? It is true that there is a risk of hypoglycemia or low blood sugar when people who have diabetes take anti-diabetic drugs that can cause low blood sugar. Not all of them, right? But insulin, for example, either like mealtime or basal insulin, sulfonylureas, including the short-acting ones like meglitinides. But there is a risk of hypoglycemia when some other medications are used as well, not as much as the insulin or sulfonylureas. Now, this risk is much lower if you are not using insulin or sulfonylureas, and we'll talk more about these medications in a second. Now, if you have any questions or concerns, write it below. With long-term intermittent fasting, one should also be concerned about protein malnutrition. So if you are not paying attention to how much protein you're eating, you're fasting, but in your feeding periods, you're not paying attention to that, you have to be careful. Because how many days a week a patient is fasting also makes a difference, and what do they eat when they're, out there getting their vitamins and minerals and so forth. Now, if you're worried about not getting enough vitamins, check out our Diavitamin on our website at SugarMDs.com, which will help you replenish some of these vitamins, especially if you're intermittent fasting. Other risks include a wide range of problems that can actually happen if you don't get enough energy and if you don't drink enough water if you're fasting with diabetes. These are the things that could happen to anyone who does intermittent fasting, no matter if they have diabetes or not, and is typically more common in the beginning, and the side effects may include dizziness, the nausea, insomnia, syncope, or passing out, falls, or the migraine headaches, the weakness, and these will make it hard to do everyday tasks, and you may have a lot of hunger pangs, right? So people who have a chronic disease like diabetes may be more likely to have some of these effects, as well as people who have, for example, heart disease, unstable angina, heart failure, atrial fibrillation, previous heart attack or stroke, cancer survivors, or people with chronic lung disease, or people with history of pulmonary embolism, asthma, peripheral vascular disease, and so forth, or even chronic kidney disease. These are the conditions that you should be careful about. They should not necessarily avoid fasting, but they should be aware that you'll know little about how fasting might affect these people with previous complications and diseases that is present right now. This is why studies need to be done in people with those chronic diseases before we push them into fasting state. So, of course, there's higher chance for these people to get sick when they're fasting. It can certainly put these people at risk for another heart attack or stroke, and death is not worth for losing a few pounds, right? And there isn't a lot of evidence in these groups of patients who are sick to benefit from fasting either. So in conditions where dehydration is a risk, such as stroke. It's good to tell people to drink a lot during any fasting regimen, and people of all ages who are doing intermittent fasting should think about drinking water all the time, even if they don't eat food. This is because water can be used to replace fluids that would normally be found in the food because you're losing a lot of water and electrolytes when you're fasting. So some groups should not be fasting at all, and these are like pregnant diabetic women or lactating women, young children, adults who are frail, very old. For example, these are the people who should not fast at all. And people who have, for example, immunodeficiencies, or people who have had solid organ transplants, or people who are on medical immunosuppression and immunosuppressive medications should not fast. People who have an eating disorder, people with dementia, and they have unique problems that will make actually fast a lot harder and difficult for them. So they should not follow intermittent fasting regimens. Patients who have a history of traumatic brain injury, post-concussion syndrome, may also be more likely to have problems when they start a fasting regimen. Patients with diabetes who are interested in intermittent fasting should be encouraged to do so with the help of a healthcare professional. It could be a doctor, it could be an endocrinologist, a nurse practitioner, a physician assistant who have some experience. Specific attention, they have to pay attention to 3 things: medication changes, glucose monitoring, and fluid intake. Some of these recommendations that I have today are based on research that has been done on intermittent fasting and diabetes, and some are my personal experiences with diabetic patients who are practicing intermittent fasting. Like we discussed, anti-diabetes drugs such as sulfonylureas, meglitinides, and insulin can cause low blood sugar, so we have to adjust. Their doses should be changed on the days when people are fasting. We should take into account how well the patient is taking care of their diabetes as well, including both fasting and postprandial or after meal glucose levels over the last 2 to 4 weeks. Whether you're fasting or taking short-acting insulin or not, long-acting insulin or not, the length of the fast, and whether the fasting is for all the calories or just carbohydrates, etc. So you have to pay attention to all that. So let's talk about the medications. Sulfonylureas, for example, like your glipizide, glyburide, glimepiride. So you can skip that day if you want to fast 24 hours, or you can take half of the dose if you want to fast just part of the day. For example, a meal is consumed at some point of the day, then you can take half of that sulfonylurea. A caution for half dose is that, you have to have a lot of education and you have to be monitoring your blood sugar to avoid a low blood sugar. A third option is not to take the medicine at all if you are going to be on a very low carbohydrate diet even when you're fasting. So that's definitely more conservative and cautious, especially if you're on a low carbohydrate diet. If you're taking natagelinide or rapegelinide or Starlix or Prandin, they work like a short-acting sulfonylureas, and you can skip those before a meal that contains no carbohydrates. And if you are taking alpha-glucosidase inhibitors such as 𝐾𝐫, you can actually skip that as well if you're not eating carbs at all for your meal after you're fasting. Dosage of basal insulin should be reduced if people don't know when they're low, right? Some people don't know that. Or they're constantly at risk of low blood sugar. If that's you, then you should do more glucose tests until you see a stable blood sugar pattern that match how you are eating during intermittent fasting. To be more specific with these insulins, I'll say, for example, if you are on Levemir, Lantus, or MPH insulin, such as Novolon N, take 1/3 of the usual dose, which is 70% lower dose, if you're controlled. If you're not sure if you're controlled or not, ask your doctor about that. You can take 50% lower dose if you are an uncontrolled patient. For example, someone who wakes up with a high blood sugar consistently, then they should be cutting back on their insulin by 50%. Again, 𝐾𝐫 or miglatol you can skip if you're not eating carbohydrates. And if you're on 𝐁𝐥 or Tresiba, you need to monitor your blood sugars closely. And if your fasting blood sugar goes below 100 milligram per deciliter, start cutting back 10% if you are going to continue to fast the next day or the following days. If you are on short-acting insulin, you should never take them when fasting, except if your blood sugar is high for one or the another reason, such as sickness like infection or something like that, then you can use sliding scale insulin under physician supervision. If you are on a pre-mixed insulin like Novolun 70/30, Humulin 70/30, Humalog 75/25, 50/50, etc., the same rule applies to short-acting insulin. Although premixed insulins are a combination of short and long-acting insulins, short-acting component can cause a heavy blood sugar crash when you're fasting. Metformin or pioglitazone or DPP-4 inhibitors such as Januvia or Tradjenta, they rarely cause low blood sugar, and you can take them as usual, so not a big problem. And metformin and pioglitazone, for example, they have some other benefits besides the glucose control, such as lowering the insulin resistance and so forth. Therefore, you should still continue them. Now, DPP-4 inhibitors like Januvia or Tradjenta, on the other hand, they're only prescribed for glucose control, so you can skip them on fasting days if you or your doctor thinks that your blood sugars are fine. Another class is SGLT2 inhibitors, like your Jardiance or Farxiga, Invokana. They rarely cause low blood sugar, but what they do is they cause osmotic diuresis, which in English, it makes you pee like a horse, okay? Due to this latter effect, the usual fluid intake changes during the fasting day. So it may be appropriate to skip taking that medication as well, like a Jardiance or Farxiga, on the days when you engage in intermittent fasting to avoid dehydration and preventing a low blood pressure episode. Now, GLP-1 agonists, on the other hand, are also safe during fasting, and these are typically like the Ozempic, Victoza, Trulicity, or Rybelsus. So what is your experience with intermittent fasting when you're on medications? I want you to let me know in the comment section below, because that concludes our video. And I want to learn from you, and I hope you learned something today. And if you did, please subscribe, pass this video to someone that you may think benefit from it. We will see you in the next video. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.